Hello, Dr. Yunus. I work with the Metazonia team and I'm part of the Wanna Be Taller team. Today, I'll briefly talk to you about height reduction. Who is height reduction applied to? Specifically, we apply height reduction to individuals whose growth is complete. We recommend an ideal age range of 20 to 35 years old. How do we perform height reduction? To a very large extent, in fact, this is what we've always done until now, from the upper leg, that is the femur, from the region where bone fusion is best. We can lengthen it 4.5, or the maximum limit is 2 inches, up to 5.5 centimeters. The maximum is 5.5, but we can consider it to be around 5 on average. It's an operation where a 5 centimeter bone block is removed, a nail is placed inside, and the bone ends are brought together. It's important to remove equal amounts from both sides. Right after the surgery, patients can usually start weight bearing and walking as early as the next day. However, since this procedure involves a controlled bone cut, osteotomy, even if the patient is able to bear weight, we still need to see proper bone healing, which typically takes 6 to 8 weeks. This healing period is important for the patient's safe recovery and overall well-being. Of course, since the muscles here also shorten, it's crucial to properly adjust that muscle balance, the muscle imbalance, and for patients to regain their health very quickly, they need to undergo intensive physical therapy during the first 6 weeks. As I mentioned, since patients can usually walk shortly after the surgery, they continue their medications until the wound healing is complete, which is typically around day 10. They take their medications for 4 to 5 days in the hospital and then continue them at the hotel or at home where they are staying. This allows them to shower after day 10 and gradually return to their daily activities. Bone fusion, a process that is incredibly important in limb lengthening, holds similar significance in limb shortening operations. If we consider who prefers this procedure, both women and men equally desire this type of surgery. Patients undergoing gender reassignment surgery may express a more intense desire for height modification. For these patients, before the operation, we take a full-length leg X-ray. We then recommend a specific amount of shortening to prevent any imbalance between the upper and lower leg, and we perform the surgery accordingly.